If you're suffering from pain in the jaw joint or the TMJ, you'll know it's no fun. In fact, pain in the face is one of the worst pains anybody can experience. So I'm going to show you guys 3 easy massage techniques you can do to reduce your pain in this area. So listen up. And before we get going, please subscribe to Riley Rehab on YouTube. Every single week I'm coming up with new content helping you become the expert of your own body. Beyond that too, this is part of a 3-part video series where I'm going to go in depth on how to deal with the TMJ joint, also known as the jaw joint. So just to start off here, there's a bunch of muscles that attach to the TMJ. I'm going to focus on 4 big ones, 3 of which attach, 1 is very closely related. And usually massaging these 4 will help in many cases for relieving jaw pain. With that being said, it's definitely worth getting checked out by a medical provider before doing any of this. The first point you're going to get is known as the temporalis muscle. Basically, it's a muscle that fans out all the way up to the side of your head, and it's involved with closing your mouth. I find the best point to massage is actually the one right underneath your ear. So if you imagine your ear, you follow it all the way up to the top. And if you were to peel that ear back, right behind it, you keep moving your hand up a little bit and you should feel a little ropey thing. It should almost feel like you're running over a little speed bump. As soon as you find that speed bump, it should be right behind the ear in this area here. All you want to do, take 1 or 2 fingers, find that point. I also should say, don't talk when you do these. Unfortunately, I have no choice. Find that point and hold it there. And keep it there for about, I'd say start with 30 seconds, see if it's calming down. If that's okay, you can hold it for up to a minute. It should feel like it starts off pretty sharp. The pain gets kind of sore and sharp, but slowly calms down. That's a sign of a good release. Also, I would usually recommend doing this on both sides, even if one side hurts, just to even it all out. Now, second point, there's another muscle underneath the jaw known as the medial pterygoid. What you would do, if you imagine your jaw basically goes like this here, if you follow it there and then up, you should be able to hook your hand underneath your jaw. So literally, if you were to just put your fingers underneath here, you can grab the corner. And that's exactly what you're going to do. You're going to take your fingers, bring them underneath your jaw. Once again, don't talk when you're doing this. Hook there. I'll move my hand so you can see. With my thumb is where I'm doing it. You want to keep it in that spot and just rest it right there on the inside of the jaw. Once again, follow the same rules. Hold this for 30 seconds to a minute. And I wouldn't do this more than once a day at first, especially if you're in pain. The third area you want to work on is known as the masseter. Now this one's very easy to find. If you ever clench your teeth together, you'll see mine probably bulges out right there, if you can see that. With this one, instead of using my fingertips, I'll just take my knuckles like that, keep them, basically look at where your hairline, your sideburn area is, and just drag your hands, you can do both hands at once, slowly down your sideburns all the way to there. When you do this, you should feel your mouth naturally relaxing and opening. Don't fight it, just let your mouth slowly open and relax. Also, don't push too hard on this if it is causing pain, because you also don't want to shake up some things, but this is a great way to release those muscles. After a whole day of chewing and talking or doing whatever it is you do with your mouth, this can be really good to help relieve the pain. And fourth, the bonus muscle is known as the SCM. If you look right here, you can see a muscle that goes all the way up there. It's called the sternocleidomastoid. Easiest way to find this is find your earlobe and go about 1 centimeter behind. And then from that point, take a few fingers. I'd probably just go 3 fingers in a row like that. Hold them here. And once again, do the exact same thing. This too will help calm down the muscle that goes all the way there. This one doesn't directly attach to the jaw for those of you who are very knowledgeable about anatomy, but it does have a strong relationship with it. So I found if you release those 4 muscles, it does really help to take the pain down. However, that only scratches the surface on dealing with jaw pain. There's a lot of other things you need to do in order to take care of it. So while this may provide excellent temporary, if not permanent relief, there's a lot of other things you can do that can help your recovery go on even quicker. So stay tuned for the next couple weeks because I'm going to show 2 other ways, both how to exercise and how to improve your daily posture and positioning so you can keep your jaw pain under control.